The Howe method is used to treat low to medium-grade hemorrhoids. The AMI Howe Doppler system allows the hemorrhoidal arteries to be located precisely in each individual patient. Special Doppler ultrasound equipment is used for this purpose. The handle is equipped with 3 high-performance LEDs, which ensure the light is sufficiently bright at all times to allow the surgeon the best possible vision. A probe containing an integrated ultrasound sensor is attached to the handle. This sensor can also receive the Doppler signal, as well as measure the depth of the arteries. An outer sleeve is placed over the probe. The procedure is very simple. The surgeon works in the area contained by the ligation window. After inserting the Doppler probe all the way into the rectum, the surgeon starts to look for arteries at a depth of 4 to 6 centimeters. Here, careful attention is required. The handle with the probe attached is turned slowly until the first artery is detected and then held in this position. The depth of the artery can now be seen on the display. The strength of the Doppler signal indicates the center of the artery. Ligation can be carried out safely up to a depth of 8 millimeters. A 5/8 needle from AMI is placed into the needle holder and then inserted into the probe. The surgeon then ligates the respective artery through the ligation window into which the mucosa is falling. Due to the rectal blood vessels frequently changing their course, it is vital that the ligature be placed as close as possible to the Doppler ultrasound. If this is not the case, there's a high risk that the artery will be missed. A second stitch usually follows the first. Subsequently, the needle is cut off from the suture, and the 2 suture ends are knotted together. The result is a figure of 8 knot. Now the handle is turned slowly until the next artery is detected and ligated as before. This continues until one complete rotation has been made and all arteries ligated. In most cases, 5 to 7 arteries will be found. However, this can vary considerably from patient to patient and may also depend on the severity of the hemorrhoids. Subsequently, it is advisable to pull the handle back 1 to 1.5 centimeters and to make a second round of ligations on this plane. The result of these ligations is a reduced blood supply to the hemorrhoidal cushions, and hence a far better balance between the inflow and outflow of blood. In time, the hemorrhoidal cushions shrink and the success of the therapy is evident some 6 to 8 weeks after, when they are back to normal. Because the method is based on the principle of reducing the arterial blood supply, Howe is extremely effective in relieving the symptoms of hemorrhoidal disease caused by excessive pressure in the arteries. Bleeding, itching, and pain are treated with great success, regardless of what degree of hemorrhoids.